Hi, everyone. Today I will be talking about how perceived healthcare bias affects the birthing experiences of African American women. Maternal health has improved over the years, but significant racial disparities still exist in the United States. African American women continue to experience higher rates of pregnancy complications and maternal death than women from other racial and ethnic groups. What's especially concerning is that these disparities remain even when factors like income, education, and health insurance are taken into account. One of the main statistics that appeared throughout the research was structural racism. Structural racism refers to the policies, systems, and institutional practices that create unequal opportunities for different groups of people. In maternal health care, this can affect access to quality hospitals, specialized services, and other healthcare resources. The studies I have reviewed found that these systematic barriers continue to influence the quality of care many African American women receive during pregnancy and childbirth. Another major finding involved implicit bias. Implicit bias refers to the unconscious attitudes or assumptions that healthcare providers may have without realizing it. Several studies found that many black women reported feeling unheard, dismissed, or not taken seriously when expressing concerns during pregnancy or labor. These experiences often resulted in frustration and loss of trust in healthcare providers. Respectful communication was consistently identified as an important part of quality maternal health. My research also found that communication plays a critical role in maternal health experiences. When patients feel respected, listened to, and included in decisions about their care, they are more likely to trust their providers and communicate openly about their concerns. On the other hand, poor communication can discourage patients from speaking up or seeking medical care when problems arise. These experiences not only affect pregnancy and childbirth, but can also influence future interactions within the healthcare system. Another important point from the research is that improving maternal health outcomes requires change at multiple levels. Healthcare organizations need to examine their policies and practices to address structural barriers, while healthcare providers should receive education that promote cultural awareness, reduces or eliminates implicit bias, and strengthens patient-centered communication. Improving access to quality care and ensuring that patients feel respected throughout pregnancy and childbirth are both essential steps towards reducing disparities. Overall, my research found that healthcare bias continues to influence the maternal healthcare experiences of African American women. Structural racism, implicit bias, and poor patient communication all contribute to unequal treatment and poorer maternal health outcomes. Addressing these issues will require commitment from providers, healthcare organizations, and policymakers. By improving communication, increasing awareness of healthcare bias, and creating more equitable healthcare systems, we can work towards improving maternal health outcomes not only for women, but specifically for African American women.